this is my intradermal Mantoux video, and so I'll start by stating the 6 rights, which is making sure it's the right patient, right medication, right dose, right route, right time, right documentation. And I'll do my hand hygiene and check the orders. The patient, Skip Rocker, has an order for a Mantoux test, or intradermal, 0.1 milliliters. And I'll again wash my hands, go get my vial for the Mantoux, and I'll verify the expiration date, the time, check to make sure there's any cracks. If it's a multi-use vial, I'll label it myself if I opened it with my initials, date, time. It's good for. And I have my tuberculin syringe. Get that ready. And then I'll clean the top of my vial. Make sure there's no particulates or anything. There you go. And then I'll withdraw the 0.1 on my syringe. Wait for that to dry. Insert it. And then I'll withdraw the amount into my syringe. Make sure there's no air in it at all. Get out of there, little bugger. There we go. So I'm gonna recap my needle. All right, and I'll put my stuff away. Go down to the patient's room. Knock, knock, knock. Hi, I'm Leslie. I'm gonna be your nurse. Can I have you verify your name and date of birth? 2 identifiers, Skip Rocker, 1/1 of 72. And I'll tell them what we're gonna do. The doctor has ordered that you get a Mantoux test placed intradermally. Have you ever had one before? You have? Okay. So you already know the procedure. And so I'll wash my hands, get my gloves, and I'll locate the site, and it will be in his forearm. And I already washed my hands, put my gloves on. And then I'll verify again before I insert the Mantoux test that it is Skip Rocker. It's the right medication, right dose, right route, right time, and if he has any allergies. And yeah, so again, we're doing this in his forearm. And patient's relaxed, has his arm out. And I'll make sure I don't have it where any veins are located at all. And I'll clean the area. In an outward motion, about 2 inches, let it dry. Wait. And so with this, we want to insert it at parallel to the skin at a 5 to 15 degree angle. And I'll pull the skin top between my 2 fingers and make sure I find the bevel and that the bevel's up. All right, Skip, you might feel some pressure here. It might burn a little. And so I'll get parallel, bevel up, put it within the skin. There you go. Now slowly insert it and see if there's a wheal that's made, a little bubble. Insert the full 0.1. There you go, and I will get rid of my needle. And I'll block the area and make sure not to rub. And then I'll get a marker and I'll circle the wheal or mark the wheal on the skin. And then I would inform the patient that he does need to come back within 48 hours to get it checked for any reaction. And then I will remove my gloves, wash my hands, and then I will document the location of the intradermal, the dose, and when the patient will need to come back. And then I'll report the results to the provider after 48 hours.